Hi, this is Dr. Mohansundaram. Today's topic is hypocalcemia. So, just fix your earphones, close your eyes, and just concentrate what I am telling. So, we'll move on to the topic. What is hypocalcemia? The straight definition is when the serum calcium level is lower than the normal range, then it is called as hypocalcemia. So, then what is normal range of serum calcium? It is 8.8 milligram per deciliter to 10.7 milligram per deciliter. Below this range, we will call it as hypocalcemia. So, according to the severity of symptoms, we can tell it as mild to severe hypocalcemia. It can occur in all age groups. It can come in infants also. If it comes in infants, then it is of genetic disorder. So, what are the causes of hypocalcemia? There are so many causes of hypocalcemia. We will see one by one. First one is parathyroid hormone, which secretes from parathyroid glands. When this hormone, parathyroid hormone, is deficient in the blood, it will cause a hypocalcemia, because parathyroid hormone regulates the blood calcium level. So, when it is deficient in conditions like a hypoparathyroidism, it may cause a hypocalcemia. So, next one is when vitamin D is deficient, then it will cause hypocalcemia. It will also regulate the blood calcium level by absorbing the calcium from the intestines. If the vitamin D is deficient, then the calcium will not be absorbed from intestine, then it will cause hypocalcemia. So, low levels of calcitonin will also cause. Then after thyroidectomy, there may be short duration of hypocalcemia will be there. So, then other condition is pseudo hypoparathyroidism. Then other condition is kidney failure. Chronic renal failure may cause decreased production of vitamin D, then it may lead to hypocalcemia. Certain medications may also cause a hypocalcemia, like bisphosphonates, corticosteroids, rifampicin, chloroquine. Then other conditions like hypomagnesemia. So, when the blood magnesium level is lower, then it will cause hypocalcemia, because parathyroid glands need magnesium to produce parathyroid hormones. When magnesium level is deficient, then parathyroid hormones will not be produced adequately. It may leads to hypocalcemia. In pancreatitis, acute pancreatitis may cause hypocalcemia, and some rare genetic disorder like Dye-George syndrome. In infants, already I told, no, in infants if it comes, it may be due to this genetic disorder. So, what are the symptoms? According to the severity of the symptoms, mild and severe can be classified. Mild hypocalcemia, the symptoms may show muscle cramps, dry scaly skin, brittle nails, alopecia. Some neurological effects like confusion, memory problems, irritability, restlessness, depression, hallucinations. It may affect the nervous system. So, if it affected, it may cause these symptoms. So, severe hypocalcemia may show symptoms like tingling in the lips, tingling in the tongues, fingers or foot. Then muscle aches, stiffening and spasm of the muscles, like as if it is in tetany. So, muscle spasm in larynx may cause a laryngospasm. Yes, other symptoms, it may show of seizures in severe hypocalcemia. In heart, it may show abnormal heart rhythms, may lead to arrhythmias. Sometimes it may cause congestive heart failure. How can you diagnose the hypocalcemia? We can take blood test, serum calcium level. So, already I told, if it is below the normal range, 8.8 milligram per deciliter to 10.7 milligram per deciliter, below this range, we can diagnose it as hypocalcemia. So then we have to rule out the root cause of the hypocalcemia. If at all we can, already I told so many causes. So, based on that, you can take blood tests. So, you can go for parathyroid hormone levels, magnesium level, phosphorus level, vitamin D blood vitamin D levels. Then in ECG it may show of prolonged QT interval. These are all the diagnosis we can come to a conclusion that it may be of hypocalcemia. So what is the management? So mild hypocalcemia we can go for oral calcium tablets and vitamin D supplements. Then in severe hypocalcemia we can go for, you have to go for IV injection of calcium gluconate. So these are all the how can you see the hypocalcemia and management of hypocalcemia. So if it is a severe case of hypocalcemia, you have to admit in ICU and you have to go for IV calcium gluconate. Then what is the prognosis of the hypocalcemia? The hypocalcemia is a reversible condition. If the blood calcium level comes to normal, then all the symptoms will be vanished and the patient will recover to normal. So these are all the short notes about hypocalcemia. Hope everybody will be benefited from this video. If you want any doubts, you can go for in comments. I will I will manage some answers for your questions. Please like, share and subscribe my channel. So when I post any videos, you can see it very quickly. Thank you. Hope everyone will be benefited. Thank you.